As part of this is going to be doing the fat transfer. So we have a special kind of technique that we use for fat transfer. And we've taken the fat that we've called harvesting. We've harvested the fat with liposuction, and we've collected it in a little trap system. 1-4. And then we put a antibiotic irrigation into the fat, which you can see over there, and then we do basically reverse liposuction. So basically the essence of it. And so the fat really has minimal time outside the human body, so it's not going to lack oxygen, so it's still pink and viable, the cells are alive. What I'm doing is just grafting it in different planes of the fatty tissue. So these are planes above the muscle. And what I'm doing is just gently kind of layering it in. It's all about layering with this surgery. And so this is a surgery that gives you a little bit more volume projection. Not projection, just fullness. To the area of the butt and hips to kind of give a little more shape and fullness. It is extremely common. All the fat that I harvested will, not all of it will survive. This is natural aspect of fat transfer that a lot of people don't quite fully appreciate or understand. Is that people who want these big crazy butts, they'll do the surgery and they're like, well, it didn't all survive, it all went away. And that's really not true, typically. If it's done correctly, it's not gonna all go away. It has limitations of how much augmentation you can get. So, volume is for the butt, and if you add volume to the butt, it has this illusion of a lift, and it really doesn't lift anything. It's just fuller. And so that's why it's called the Brazilian butt lift. But what I'm doing is layering it into the soft tissue. It's just above the muscle, it's in the fat tissue, and then it's under the skin. So it's kind of 3 layers, I will call it. I'm always parallel to the muscle tissue, always respecting the human anatomy, the natural anatomy. Just adding a little more fatty layer, that's all. That's really what BBL transfer is just adding in the right spots. It's not so much a projection thing. A lot of people think it's projection, it's actually not. Just fuller. The hip dips where a lot of women hair don't like these hip dips, which is a natural, when you focus on that word again, natural human anatomy, is to have a little bit of less fat over the lateral aspect of the gluteus maximus muscle. If you don't believe me, look at bodybuilders and you'll see how their butt shape. To have it full is not natural, but it's a look that a lot of women want. So it always amazes me when you have patients come in and they do the fat transfer and like, I still have a little bit of a hip dip. Reality is that's natural. That's where you were made. It's not natural to have it fully filled out. So, those women who really want these exaggerated, full, I call Brazilian look, where you're very, very curvy, the reality is that you might need to do the fat transfer a couple of times to get that lateral hip dip we call filled out. So I only use one hole for this. And at some point, there's a limit to how much the soft tissue can take. And that just starts coming out the same hole, in which I'm pretty much there. I'm just kind of finishing up making sure everything's smooth and round. All right, done.